Health matters. Prevention is better than cure. Tọ́jú ara rẹ̀ kó tó pẹ́ jù. Ètò ìlera ó ṣe pàtàkì, ó ṣe kókó. Health matters. Prevention is better than cure. Tọ́jú ara rẹ̀ kó tó pẹ́ jù. Labake ti wà lórí ètò láti bá wa sọ̀rọ̀ nípa ìlera rẹ̀. Àìsàn wo ló ń ṣe ọ́ tó kò máa bẹ́ aṣọ? Sọ́kà gbọ̀n àwọn ọ̀jọ̀gbọ́n ṣàlàyé fún ẹ. Ẹni tó bá dákẹ́ lára ẹ̀ á ká dákẹ́. Tọ́jú ara rẹ̀ kó tó pẹ́ jù. Tọ́jú ètò ìlera ó ṣe pàtàkì, ó ṣe kókó. Health matters. Prevention is better than cure. Tọ́jú ara rẹ̀ kó tó pẹ́ jù. Àwọn àìsàn tá a rí èyí tàbí kò dá lára. High blood pressure, anger issue kò dá lára. Depression, anxiety ó lè ṣekú pani. Tọ́jú ara rẹ̀ kó tó pẹ́ jù. Bóyá tọ́jú ètò ìlera ó ṣe pàtàkì, ó ṣe kókó. Health matters. Prevention is better than cure. Better tọ́jú ara rẹ̀ kó tó pẹ́ jù. Àwọn ọ̀jọ̀gbọ́n ti wà lórí ètò láti bá wa sọ̀rọ̀ nípa ìlera rẹ̀. Àìsàn wo ló ṣe ọ́ tó kò máa bẹ́ aṣọ? Sọ́kà gbọ̀n àwọn ọ̀jọ̀gbọ́n wá ṣàlàyé fún ọ. Ẹni tó bá dákẹ́ tara ẹ̀ á bá dákẹ́. Tọ́jú ara rẹ̀ kó tó pẹ́ jù. Bóyá tọ́jú ètò ìlera ó ṣe pàtàkì, ó ṣe kókó. Ó ṣe kókó. Health matters. Prevention is better than cure. Ìlera ló tọ́jú ara rẹ̀ kó tó pẹ́.
Hello, my viewers out there. Hello, everyone. I hope you all have a wonderful day today. How was work? I hope it wasn't too stressful. You're welcome to second edition of Health Matters program. Before I start this edition, before I start the program, I want to say a big thank you to all my audience that joined me last month. I want to say thank you so much. I really appreciate you. Thank you for all your support, for everyone that shares the video, for everyone that liked, for all the comments, for all the feedbacks. It was really amazing. Thank you so much. Thank you so much. Thank you so much. So today's program, I told you last month that is going to be once every month. And I said, you're going to be hearing me on Open Radio Internet program. And also I said, you will be seeing me live. And I did mention last month, I said, I will be bringing in professionals on the program that will be able to will be talking about various issues on mental health. I did mention, and I'm happy to tell you today, I've got on a special person on the program. He's not just a medical doctor, he's a consultant, he's a psychiatric consultant who has been in this field for many, many years. He has actually worked in various mental health settings. He's got loads and loads of theoretical and practical experience. As you all know, my name is Labake, also known as Elizabeth. Here with me on the program, I'm not going to say the introduction. I'm not going to do the introduction. So I've got the honor and the privilege to have my consultant, a psychiatric doctor, with me. He's going to introduce himself. He's going to tell me his background. is going to tell me briefly where is what, and we'll pick it up from there. You're welcome to the program, sir.
Thank you very much, Labake.
So may I know your name? Can you tell my viewers your name, your specialty, just brief summary about yourself?
Okay, my name is Dr. Olatunde Kassim. I'm a consultant psychiatrist and I'm based here in London. I've been working in the area field of psychiatry for many, many years, well over 20 years, and I've worked in various settings, both inpatients and in the community. I've worked the length and breadth of this country up to Scotland, and we have seen a lot of people with this kind of condition that we're going to be discussing today. May I just quickly seize this opportunity to kind of congratulate the organizers of this program. I think it's a very good program that would inform people because we always say that knowledge is power. When you know about things, you can do something about it. And I think it's a good program that is going to help our people. Thank you very much.
Thank you so much. As you've heard from the horse's mouth, he's got more than 20 years experience. Wow. Thank you so much. So the topic today, before we go into the topic, may I let the viewers know that this program is designed to create awareness of various issues we have in mental health. I've made it clear from the onset, which I'm going to say again, we are not giving any diagnosis on this program. We are not going to giving any private number to see a psychiatrist. All we are going to be doing is signposting you and telling you the signs and symptoms of what to watch out for. When you realize you have them, it is not a program set to scare anyone. When you realize you've got this particular issue, what can you do? Go to your GP. How can you make referral? What support is out there? So the topic for today is bipolar. Bipolar is something we're going to know what it means. What are the signs and symptoms? So I'll leave it to my doctor to talk about it. So Dr. Olatunde, when you say bipolar, so what do we mean by bipolar? How can people know they've got this thing?
Okay, bipolar affective disorder is a condition that is recognized as a mental disorder. In fact, it's a serious and major mental disorder that affects mood. Basically, what it means is that it affects people's mood. And if we think, I think we all probably would have heard about depression. It's a bit quite similar to depression, except that in bipolar disorder, people do have depressive episodes, and they also have what we call a manic episode or hypomanic episode. That makes it a bipolar that is two extremes of moods.
Thank you so much. So for viewers who don't understand the medical terms, so in a layman language, so when you say bipolar, you just mentioned that it actually has to do with mood. For me, that I'm a mental health nurse, I might be able to understand what you mean. But for viewers out there who doesn't understand, we're not into the nursing, or we're not doctors, who don't understand what in a layman language, for my audience out there to understand what we're talking about. Can you kind of break it down to somebody like you when you're just talking to a normal person? So when you say bipolar, can you kind of bring it down to my viewers level?
Okay. Basically, what it means is that if we look at most people who we consider to be normal, their mood, you could say, are level, but in bipolar affective disorder, they usually have extremes of mood. There would be periods when they say they feel down, they're low in mood, they're not eating properly, not sleeping properly, they lack motivation, they don't want to do anything, they just want to sleep all the time. This is what we call a depression. Then they can also have an episode, a separate episode that is kind of to the other extreme, which is their mood. It's a bit like the opposite of depression. Their mood is extremely high, which we call elation in mood. They don't eat very well, they don't sleep, they don't sleep very well, and they don't feel that they need to sleep. They increased energy. They're all over the place. You know, they want to do 1,001 things at the same time. And in some cases, it can be quite dangerous actually, because they start doing all sorts of risky things, like spending money recklessly, or maybe be having sexual relationship with strangers and things like that. Very serious things. And more importantly, the fact that there is a high risk of people actually harming themselves when they're in that kind of state. It could lead to suicide, for example. So it is a very serious condition. But what happens is that they can have a depressive episode which can last for a period of weeks to months. When they come out of the depression, they might experience an kind of what we call hypomanic or manic episode, which is mood going high. So they go in that kind of cycle from time to time. Yeah.
Thank you so much. So for viewers out there, I think even if you're not into the nursing field, like you have the consultant just explained now, that it's combination of at a stage you can be feeling depressed, then at a stage you're kind of hyper, very high, that you're doing all things that you can't even imagine that when you're normal you can do. That's actually very interesting. So Dr. Kassim, what are the signs and symptoms? What are the signs and symptoms to watch out for? Because sometimes, if you look at this definition, sometimes we all fall into this definition. And so what are the signs and symptoms? Is there any particular signs to watch out for that? When I'm getting to this level, this is a kind of signs for bipolar. So is there any particular sign and symptoms to watch out for?
Well, according to the International Classification of Disease, the way we diagnose bipolar is when people have a diagnosis of depression, and then following that, they now have a diagnosis of, say, hypomania or mania. The difference between hypomania and mania is they're quite similar, but hypomania is less severe in terms of presentation. And some people with hypomania may actually not know that they have this condition. It's the family and friends that will be telling them you're a bit different, and you're just wondering what's going on. So, but it's quite similar. I would talk about depression, and I will also talk about hypomania and mania. In depression, what normally happens, most of the times you can see this presentation in people to start with from their appearance. Somebody who is depressed, as for example, may not wish to speak, may not wish to talk, and they may be very slow in doing things. For example, they will have problems. They will say they are constantly feeling down and low in mood. They are not sleeping properly. They are not eating properly. They've lost weight. They're not able to concentrate. And in quite severe cases, they are not actually going to be able to function. For example, go to work, have a good relationship with the family, and generally, it is a difficult problem. That is with people with depression. When it comes to, if you think about depression, and we're talking about mania now, is the opposite to depression.
Okay.
If they have low mood in depression, in mania they have high mood. If they have low energy in depression, in mania they have high energy. They are on the go all the time. They do several things at the same time. And in fact, they will tell you that they feel that their thought is racing. They have so many ideas in their head, and they are up and down the place. In depression, they may not be able to sleep. Sometimes in depression, they sleep too much. But in mania, they actually are not able to sleep. And the difference between that and not being able to sleep in depression is they don't feel they need that sleep. They feel they can survive without the sleep. So in mania, their concentration is poor as well, just as in depression. Their motivation, they feel motivated. They want to do quite a lot of things, like I said. But at the end of the day, they start doing several things at the same time, not being able to complete any one of them. In extreme cases of mania, they can have psychotic symptoms. For example, they can have what we call grandiose delusion. Some people will believe that they are the prime minister, for example, that they are the president of the United States of America. They will say things like that. That's what we call grandiose delusion. They can have other psychotic symptoms as well, like paranoia, believing that People are after them. People are trying to harm them. They're watching them. They're monitoring them. All these kind of things. This happens in extreme cases of mania. Like I said, hypomania is a less severe form of mania. Of course, in hypomania, they still feel quite happy. They feel quite energetic. In fact, in some cases of hypomania, people seem to be a bit more effective. They're able to get more done. But the difference between that and mania is that in hypomania, they can actually function. Say, for example, go to work, still with the hypomania. But in mania, they are not able to function at all. And they're just all over the place.
Thank you so much, Doctor.
Yeah.
You mentioned earlier on that sometimes for those people who are really, really feeling on the higher side, so that to carry my viewers out there along, so I won't be using the medical terms. I'm going to just talk to you like we're gisting and you one-to-one.
Yes.
You did mention that for those people who are on the higher side, that they believe they don't need to sleep, because it does happen. Some people, they work so hard because of this busy schedule. They do some pieces of things. They don't finish them. They leave them undone in pieces, and they have like 4 to 5 hours sleep. So can you tell my viewers out there, what is the effect of not having enough sleep? How does that affect their mental state?
Yeah. I mean, sleep is very important. We all do have to sleep to be able to function. If you're not able to sleep, all sorts of things can happen. For example, people may start experiencing illness, psychotic illness, for example. They start saying the same things, or they are hearing things. It's just very difficult without sleep. Just sleep on its own, But when you're not sleeping and you have what we call a manic episode, people like that, they keep going until they kind of collapse, really, because they can't recognize it and they're not able to do anything about it.
So are you saying if you deprive yourself of too much, which is on the bipolar symptoms, which is when somebody is on the hyper side, that they feel that there's no need for them to sleep?
Yeah.
So are you saying that if it's becoming too much, somebody can collapse?
Yes, definitely. Yeah.
So viewers out there, as I know you're listening, and I'm going to open the line very soon, and the number to dial in to contribute. You can ask questions. I've told you, I understand this is private. This is health matters. I understand confidentiality. You don't have to mention your name. You don't have to tell me where you're calling from. If you want to, feel free. Please go ahead, but it's not a must. The number to dial and ask question on this program is 079 049 416 004. I repeat the number. You can call, you can ask question, you can contribute. The essence of this program is for us to dish out information. So just to, like I said to you, just a way of supporting one another. I didn't actually know a bit of this about bipolar, despite the fact that I've been into this business for years as well. But it's as we all know, knowledge is power. So the number to dial in, we learn every day. Like you had my father said, is actually a good program to educate one another about mental health, to tell you what to do, the signs and symptoms. We're talking about bipolar as a mental health disorder. The number to dial on is 079 049 416 004. The line is open now. If you want to dial in, you can dial in and ask your question. So you did mention earlier on that some people have had cases like that as well, that they do have sex with a unknown person. Is that part of the symptoms of bipolar as well?
Yeah, it can be. Those are one of the risky things that people with mania, especially, will do, because that is what we call sexual disinhibition. They've lost their normal inhibition that they would have, even if one is thinking about doing something like that. we all do have this level of inhibition that we can stop ourselves and say, this is a bad thing, I'm not going to do this. But people with mania, they don't have that inhibition anymore. They just do things without thinking about it and the consequences. So you find that people like that become quite promiscuous when they are having this episode, having different relationship with different people. Some people will be going to clubs and having a one-night stand. And this is the problem, you see, because by the time they recover from that episode and kind of got to know about what they've been up to, it becomes a problem. In the sense that in some cases it's been known that people have actually committed suicide because of that.
Interesting to know. So what treatment do we have for this diagnosis? What treatment do we have for this illness? Is there treatment? Is there medication? Is there therapy?
Yeah.
So can you tell my audience so when you realize you've got bipolar, what can you do?
Yes. The treatment is mainly medical or biological form of treatment, or we also call it physical treatment, which is medication.
Okay.
There can also be psychological intervention. Psychological intervention is very limited to something like, say, psychoeducation and cognitive behavioral therapy. If we have time, we might be able to talk about that at some point. But I would like to talk about the physical treatment. To start with, if you have somebody who is presenting with this problem, what you need to do is do a complete assessment, which involves having to see the patient and take a history. The history is not just limited to the patient. History also involves the family, the social life, drug and alcohol, medical history, physical history, because all these things are interrelated. And once we've done that, and we feel that maybe this person has bipolar, we also do investigations. The reason why we do investigations is to rule out any organic cause, because there are some physical health conditions that can actually mimic bipolar. And we call them organic brain disorder, organic mood disorder. It can happen if there are problems, for example, issues about head hemorrhage, brain hemorrhage in the brain, people with, say, infection of the brain, encephalitis, people.
I think we've got a caller on the line, so let's pick that call.
For example, issues about
Hello.
Hello.
You're welcome onto the program X Matters. Can you please lower the volume of your TV or radio, please?
Okay, I've lowered it.
Thank you so much. I've got one of my consultants on the program. They can listen to you. Go ahead.
Okay, yeah, I was going to ask that, when you mentioned bipolar, sometimes it's just a quick question, maybe it's a symptom to be worried about. If after losing someone and you're still like feeling down and sometimes you're excited or something, how does bipolar relate to bereavement or something? When should I be worried?
Okay. Thank you for that question. It's a very good question. The bereavement, people can present with mood symptoms in bereavement. Most usually, they present with depression. And in fact, they can have depression along with the bereavement symptoms. Because in bereavement, people find that they are feeling down. Of course, you've lost a loved one. You're not sleeping or eating properly. But those symptoms are not usually as severe as when we say people have depression. But in quite a lot of cases, they can have depression along with bereavement symptoms. In bereavement, is not very common that people present with what we call manic episode, except if in situation where the bereavement, it now becomes a trigger to trigger this illness in someone who basically predisposed to developing it. Maybe they could have developed at a later date, but because of that stressful event, they then present with symptoms of bipolar.
Thank you so much, Kola. So thank you so much, Kola, so that we have another people calling in, because I can see we've missed one of the call earlier on. So thank you so much, Kola, earlier on. So basically, you were talking about before we received the call. As the calls are coming in, we will be stopping, we will be picking your calls. So please call in. The number to call is 079 049 416 004. I repeat, 079 049 416 004. Okay. So you were talking about before the caller came earlier on, you were talking about the treatments that people can, when they realize that they've got this. So you were talking about the services.
Yes.
And can you please? Yeah.
I mean, when we see patients, and now we've done our investigations, we've now diagnosed bipolar. The first thing is that you want to really educate the patient.
But may I ask you, doctor, before getting to that stage, for people who lives in their house that realize, how will they get to your stage? What is the procedure to see a psychiatrist?
Okay. In this country, United Kingdom, we all have GP. If there are any concerns about people's mental health, either physical or mental, they need to go to their GP.
Okay.
Once they see their GP, then their GP can refer them to the local mental health services.
Okay. So viewers out there, as you can hear, that if you find yourself that it seems as if I'm having something similar, the first thing you need to do is go to your GP. Like I always say, this program is designed to create awareness about mental health and where to get support. So go to your GP, discuss with your GP, then your GP will refer you to the psychiatric, to the mental health, local mental health services, who will be able to give you the right support that you need. So go on.
So we were talking about treatment.
We've got another caller. Let's pick that call, please. Hello, welcome to Health Matters. Hello, can you please reduce the volume of your radio? Or
Okay, I have.
thank you so much, ma'am. So you're welcome to Health Matters. Go on with your question.
My question is, if there's someone that I believe has got this condition, what's the best way to help the person?
Okay. The best way to help the person is for that person to seek help immediately. So, if we may be able to persuade the person to go and see their doctor, so that they may actually, because in actual fact, the earlier we're able to get this illness, the better is the prognosis. So if we can start treatment quickly, they recover quite quickly as well. But if it's left untreated and it's delayed, it can cause further complications and problems. So what I would suggest is that person should go and see their doctor immediately, and their doctor would know who to refer to the local mental health services where they can be seen.
Okay, but how about if it's a situation where the person doesn't even want to admit there's something wrong, but you definitely know there's actually something wrong with him or her?
Again, it depends. It can happen that maybe they do have these symptoms. It's not as bad. Just like I said before, in some cases, it's the family or close relatives and friends that would notice that there had been a change in this person's behavior. And they may sometimes point it out to them, but in some cases, they may not accept that they have the problem. If that happens, that is a problem. But then it boils down to the fact that whether that person actually has capacity at that point, whether they know what they are doing, and whether they can make that decision as to whether they should seek treatment or not. In which case, especially where risks are involved, there may be a need to actually contact the GP to do, say, home visit to see the person, and possibly consider treatment or referral to the local mental health services.
All right then.
Thank you so much. Thank you so much. I think that was a good question, and I was coming to that actually. So, in situation whereby people have the symptoms and it's glaring, and they're not admitting it. So, like the last caller said, that you mentioned that it boils down on two things which I picked, and I want you to explain to my viewers out there that if they got capacity. For somebody who is out there who doesn't understand what you mean by capacity, can you talk more about what do you mean by if they got capacity?
Okay. Generally, every adult is believed or believed to have capacity. So you have to presume that everyone knows what they're doing. They are able to make their decision.
Okay.
And they are fine to do that. Even it might be an unwise decision sometimes.
Okay.
For example, somebody may say, I want to go and buy a watch for £10,000, go and borrow money to buy the watch, yet still not feeding properly at home. But it may not necessarily mean that they haven't got capacity or understanding of what they're doing.
Okay.
It's just that they're doing it at that point, and that was what we call unwise decision.
Okay.
Basically, what we use to test capacity is whether that person understands the decision that we're talking about. In this case, to go and seek treatment for their mental illness, whether they're able to retain the information.
Okay.
Because if in cases where people have memory problem, they can't remember things.
Okay.
Or whether they can weigh the risk and benefit of actually going for treatment or not, and whether they're able to communicate their decision, that is, I'm able to say that, yes, I need to go to hospital or not. If they fail on any of those 4 assessments, they are presumed to lack capacity.
Okay, thank you so much. So in the situation whereby the person lacks capacity and is becoming a risk, what can the people, the family, what can they do?
Then obviously safety comes into it. For example, people are doing risky things. They're very unwell. They're trying to harm themselves or kill themselves. Then the family needs to call the emergency services immediately. It could be the police, who would then get the ambulance to come, and they may need to arrange a social worker and doctors to come and see the person at home. It may require that the person is put under section, which means to be detained in hospital for the purpose of treatment in their own best interest.
Okay, so viewers out there, I think you can understand what the doctor is trying to say. So in that situation, I think what the mains they're trying to say is that in situation whereby the person lack capacity and they're putting themselves at risk, they lack capacity and they're putting themselves at risk. So you being the family, all you need to do is get your phone down. Like, for instance, we did mention about a lady going out sleeping with various men, and they're not aware of what they're doing, or somebody may be driving recklessly, and or probably going out, coming lately, or probably doing things that they are harmful or that could actually be a risk to them, to their lives. So I think what they are saying is that you can dial 999 and ask for ambulance. You can dial 999 and ask for ambulance to actually take them to the hospital, or you can actually, when they get to the hospital, then they will know what to do. They will know the best thing to do. So moving on, we've got a text message come through just now. Somebody's asking about what about I know we're talking about bipolar. I know, but somebody is just texting a question now and asked that, what about schizophrenia? Has that got any similarity? Has it got anything to do with bipolar? Can you please let us know?
That's a very good question.
And the second question is that, what causes it and how can it be avoided?
Okay. The question about schizophrenia is a very important question. In some cases, it's very difficult to differentiate schizophrenia and bipolar, especially when people have a manic episode, because it is actually said that people with bipolar, about 10 to 20% of them can present with symptoms of schizophrenia.
Okay.
For example, they can have psychosis like paranoid delusions, hallucinations, and all those things that people in schizophrenia
let's break it down for my viewers out there. So when you're saying somebody's is got psychosis symptoms, and you were saying, for me, I might understand, for my viewers out there, we are not into the nursing field. So when you're saying somebody's having delusional ideas, they're having paranoid thoughts. So can you break it down in a layman language?
Yeah, I mean, they're usually quite, for people, they're usually quite strange in the sense that people have this fixed false belief. Fixed false belief that people are after them, people are trying to harm them, that they are being monitored and being watched on the cameras, for example. these paranoid symptoms, it can also come as a form of grandiose delusion in which they believe they have special powers. And some people believe they are God, or that they are prime minister of this country, or they are going to have lunch with the prime minister when they are really nobody. So, and also there are other psychotic symptoms as well. For example, people have this strange and weird belief that, you know, people can manipulate them. They can get kind of get into their mind. They know what they are thinking, or that they can control them. For example, using all sorts of things like telepathy and all those things. So those are typically what happens in cases of schizophrenia.
Okay.
But in people with schizophrenia as well, they can't have much symptoms.
Okay.
For example, they can become depressed as well, and they can actually be high in mood.
Okay.
In schizophrenia. Likewise, in bipolar, like I said, we can have symptoms of psychosis, like say schizophrenic symptoms in bipolar. Yeah,
So
and at
it
times
kind
it's
of-
very difficult to actually differentiate. And we do have another diagnosis called schizoaffective disorder,
Okay.
which is a condition where people have schizophrenic symptoms as well as affective symptoms, like say mood, depression,
Okay.
or mania.
Okay.
That's called schizoaffective disorder. But in that cases, usually those symptoms don't happen together. They will have symptoms maybe for 2 weeks of depression,
Okay.
and say another 2 weeks of being psychotic,
Okay.
and having paranoia, delusions and hallucinations and all those things. So yeah, so it can be quite difficult, but that doesn't matter. They are all quite serious mental health problems,
Okay.
and their treatment seems to be quite similar as well.
Okay. So the second question that was sent was that how can it be avoided? So I don't know in what sense. So I think what can they do when they realize that such thing is happening? So is there any therapy, or does it have to be with medication?
I mean, the issue is to avoid it. It's very difficult to know whether people can actually avoid it, because there are some people that are actually vulnerable and predisposed to developing it.
Okay.
For example, if one has a family history of this mental health condition, they are said to be about maybe 10%
Okay.
more likely than general population, general people, of developing the same condition.
Okay.
Just like the family member. So I mean, there are a lot of research and work being done currently to see whether we could be able to identify some genes and things responsible for this illness.
Okay.
But the bottom line is we still don't know. We just know things that are associated and things that may likely kind of cause it. For example, if somebody is using drugs and alcohol, they may present with symptoms like that. Drug and alcohol can actually be a trigger to actually precipitate or bring the illness out. And in fact, people with this bipolar illness do have comorbid, we call it comorbid, that it's coexisting other problems, like say drug and alcohol problems.
Okay.
With it. Because some people may attempt to actually use it, drug and alcohol, as a form of treatment, rather than going to hospital to get treatment. And, occasionally it may just be that they start using it as recreational, and, it developed into something else.
Thank you so much. So I think that question has been dealt with, that schizophrenia and bipolar kind of have something in similar, and even the signs and symptoms as well kind of go hands in hands with one another. And I think we've been told that the treatment is out there. That is what's actually more important. That look, all these things we're talking about is that we've got a lot of support out there for you people. So please, please, please don't be ashamed. Don't think people are looking at me. Oh, some people even think as soon as I go to my GP, it's gonna be in my record I've got mental health. Please, my viewers out there, wherever you are, will you rather die in silence? Will you rather have you or somebody you love go through the pain of doing things that ordinarily, when they're okay, when they're mentally stable, they wouldn't do? Bipolar, as we've had, is more or less has to do with mood swing. They sometimes being on the lower side. they're so depressed, and sometimes, so we talked about depression the last time, but bipolar, according to the consultant, is saying that you can have those two symptoms, being depressed at a time, later you find yourself being hyper. Hyper is not doing normal thing. Hyper is when you're doing extra and you're jumping from one thing non-stop, getting you and I know that when you're really, really hyper, you know what you're doing, and and especially, I didn't actually know about, we learn every day. I got to realize that so some people that sleeps around is actually a condition, mental health condition. So it's not everybody that you think, oh, he or she is a flex. It could be mental health issue. The more you identify it, the more you accept, the more it's better for you, and to get the support. Go to your GP. Like I said to you, it's just not as good as when you have a headache. You know what to do. You need to take paracetamol. Mental health is not something to be ashamed of. We will keep talking about it, and it's going to be a program that will be dealing with each issue on mental health, and we'll probably be having people that will come on the program to talk about it. And like I said earlier, the line is open for you to call in. The number to call is 079 049 416 004. I repeat, 079 049 416 004. Thank you so much for that wonderful education. So viewers, you know now that if you don't know, if you have depression and you're hyper, you have those two symptoms happening, it is a mental health condition. It is called bipolar. And that is why I've told the doctor to break down in a way whereby people will understand what we're saying. So, and the good thing about all these issues that there are treatment out there. You made mention earlier on about you talked about the medication bits, and you said there's psychoeducation.
Yeah.
Can you please tell audience what you mean by psychoeducation?
Yeah, I will. Just to quickly clarify again, with regards to diagnosing bipolar, like I said, it comes in episodes that they can have depression or hypomania or mania. In some cases, people may not have depression, but once they have 2 episodes of hypomania or 2 episodes of mania, that still qualifies for a diagnosis of bipolar.
Okay.
There is also something we call mixed episodes, which means people have symptoms of depression and symptoms of mania at the same time.
Okay.
And that can also happen. So just going into for treatment, like I said, when we are looking at treatment for a patient, we have to, it has to be an holistic approach in which, the psychiatrist alone cannot do it. So we require support of CPN, support of social worker, because we look at all those factors and things around the patient that may actually be making their situation worse. For example, somebody who has young kids, we need to consider risk to ourselves and to the kids as well. And this is where social services comes in. And when social services are involved, does not necessarily mean they're going to take the children away. What they tend to do is trying to see how they can provide support for that person at their home, so that they are safe, the children are safe as well.
Okay.
So what do we mean by support? Support may mean like things like, respite, or paying for children's to be somewhere for a few hours to give mother respite and things like that. So they can do quite a lot for people. It's only in extreme cases that they resort to actually having to remove the child. It's not very common. As you can imagine, if we could have the incident of Victoria Colombier and those other incidents, so that's to tell you that they don't actually go there to grab children or to take them away from their family. So going back to the treatment, like I said, we begin with psychoeducation. It's important for the patient and the family to understand what is bipolar and how it may impact on that person, because bipolar disorder is a major mental illness, and I must say is a serious mental illness. However, the good thing about it is that it is treatable, and people can function normally if they take their medication and they get treatment as appropriate. The problem is if they don't take treatment, it becomes a problem, and in extreme cases, people have been known to actually commit suicide. If I may say, the extent of the problem is such that if you look at heart disease, generally heart disease does not kill as much as bipolar. And some cases of cancer as well does not kill as much as bipolar. It is actually said that about 15% of people with mania or bipolar will kill themselves, which is quite a huge number. So it is important to explain to the patient and the family and about the symptoms, what they need to look out for, the importance of having insight, understanding this illness, and the importance of taking medication, and the fact that they might have to be on medication for quite a long time. Because these medications are very effective, and they can help to stabilize that person. That person can go to work and do whatever they want to do, without any problem, as long as they take medication. The problem comes when they stop the medication, and then they either relapse into depression or they have a manic episode. So we need to psychoeducate them, look at the family structures, family support and network, and things like that. We need to provide them information about this condition, and also give them or signpost them to charitable supportive organization. For example, in this case, there's something called Bipolar UK. If people go on the internet and check that, they can give you a lot of information. They can tell you a lot about bipolar. They can support you. They may have network. They might have places people will go to meet other people with a similar condition, so that they don't feel that they're alone in this problem. So now, from psychoeducation, the next thing now is that, assuming we've ruled out physical or organic cause, just like I said, people with, say, a brain tumor, for example, may present with symptoms of mania or depression. People with infections of the brain cells, meningitis or viral infection, encephalitis, people with head injury, people with a lot of other, like say epilepsy, for example. After an epileptic attack, they may present as what looks like hypomania or mania. So quite a lot. So then somebody with thyroid problem, for example, if they have low thyroid level, they may have depression. If they have high thyroid level, they may present as being mania or hypomania. So quite a lot of, and also some medication that we prescribe, they are prescribed medications. For example, steroids. Steroids can cause depression. It can cause hypomania or mania. And a tablet or medication that is used for Parkinson's disease is called L-Dopa. It's another one notorious for causing these problems. So even prescribed medications can actually cause. But I know some people do go and use steroids. They buy steroids on the streets and all this kind of thing. So that can cause problems as well. So anyway, going to the treatment, medication is the cornerstone of treatment in bipolar. Okay. So, and the group of medications that we use, number one, we use what we call mood stabilizer. One example is lithium. The other one is sodium valproate, carbamazepine, for example, and maybe lamotrigine. Okay. Lithium is actually originally an anti-manic episode. It was previously used in the United States to treat certain heart conditions, but it was withdrawn from the market in 1949 because people were dying. But since that time, it's been brought back, and with close monitoring of blood for lithium. So obviously the mortality have reduced quite significantly because of that. So those are the mood stabilizer. But there are also antipsychotic medication that we use that tend to have mood stabilizing effect. For example, olanzapine, risperidone, quetiapine, aripiprazole, all the medications that can be used, antipsychotics that can be used. Then also we do have benzodiazepines. These are sedatives. In cases of serious mania, it can be quite helpful in the first few days to calm people down. So we may give them, say, diazepam or clonazepam or things like that. But for the long time, is actually just the use of mood stabilizer. There's this one special group of people that I want to talk about, is people who are young, in the childbearing age. We always have to be careful when we're thinking about medication for those people, because some medication, especially those mood stabilizers, they can be quite teratogenic to unborn babies. And they can cause fetal malformations and things like that. In fact, some of them are banned. They're not supposed to be used when people are in childbearing age.
So that is to tell my viewers that self-medication is not good. Yeah. So if you have an issue, be it mental or physical health, so the fact that Mr. A uses this medication and it works for them is actually doesn't mean you should use it. And that is why we always encourage people not to self-medicate, to always go to the GP, because what works for you, the medical condition you have might be different from what the other persons are. So it's always good when you always go to your GP, because your GP, don't forget, your GP has all your medical history and they know better. So rather than you just cut corners buying things in the streets or online, they're not good at all. So like I said to you, some people sometimes they hear and listen to this program and they picked the name and say, okay, I can order that online. It is not a good thing at all. So if you think you've got what we've been talking about, if you think you've got all these symptoms, all the signs, the essence of this program is for us to talk about it and for you to understand and pick and check yourself, examine yourself and see, oh, do I fit into this? Or do anybody, you know what I mean, that you know fit into this category? Then what can we do? We've talked about what you can do if it's you or if somebody. We also mentioned that even if the person who has the condition refuses to accept, what you can do, the process of you getting support. Because like we had from the consultant earlier on, that if you don't treat it on time, it could lead to what is not expected. I want to say a big thank you so much to my guest on this program today. That was really, I learned a lot. I want to say a good thank you to my guest today. And like I said, we still got 10 more minutes to go. If you still want to call on the program, it's 079 049 416 004. The line is still open. If you want to call, you can call and contribute. You can call and ask questions. We still got 10 more minutes to go on the program. So that was actually a really, thank you so much for coming today. I really appreciate. And for viewers out there, and you know, when sometimes we judge people without knowing what is wrong with them. I never knew bipolar could actually make somebody actually doing some certain things that they would never imagine to do if they're normal, you know. So we learn every day, and that's why they said knowledge is really power. That was a good information we got to them on bipolar, and it's been covered, the signs and symptoms, and the treatment has been covered. And I know some people, they don't really like medication, but let me tell you the truth about it is that if you've got headache, and if you think, oh, I don't want to take medication, I want to sleep, I want to rest, and after resting, and if the problem is still there, what do you think you would do? You will take paracetamol, isn't it? If you wake up and the headache is still there after lying down, you will take paracetamol. So if you know the problem is there, why don't you accept it? Why don't you look into it? Why don't you deal with the problem before it goes out of hand, before it goes to a stage whereby it becomes psychotic issue? So the earlier the better you are able to pick all this issue. Don't ignore them. Depression is not a big deal. Bipolar is not a big deal, but it's only a big deal when you neglect it for too long and you refuse to get the treatment needed on time. And like I said, we heard from a doctor today. He said even people die more of bipolar than people who have heart issue. Isn't that what you said earlier on?
Yes.
So
heart-related diseases.
So that is actually, if you leave it for too long, that is actually when it becomes a big issue, when it becomes unsafe. And we've had earlier on, for you people that think, oh, if I've got children, if I've got mental health, they will get social services involved, but not to come and take your children. They will come and support you. On this program, I will still bring a social worker We'll go into details, what they do, how do they support, and we're going to ask them, do you really take children with if their parents has mental health? Then they will enlighten us, because I realize a lot of people have wrong information about social services. They're not out there. They're out there to protect you. They're out there to ensure you and your child, whenever you're going through mental health issue or any form of illness, are safe. You understand? So we still got 5 more minutes to go on the program. The number to call is 079 049 416004. So, you know, earlier on you were talking about the psycho education. And so, which is actually, I find quite interesting.
Yeah.
That so it's not just giving you the medication alone.
No.
They will educate you, isn't it?
Yeah.
They will educate you on what to expect, how to support. And I don't know if we mentioned it last month, that if you have somebody who is going through mental health illness and you're looking after them, you yourself, they've got support out there as a carer to support you, which is one of it, isn't it?
Yes.
To educate you on looking, because it might be difficult. Like, for instance, if you got somebody who drinks so heavily, takes weed, takes all this hard drug, and you think, oh, because sometimes, you know, when we are not aware of all these things, we tend to think, oh, they're stubborn. They just want to be the black sheep in the family. They just want to be the ones spoiling the family's name, especially we Africans. We label them, not knowing it is a condition, not knowing it can be dealt with. Do you get what I'm saying? So now that we know that bipolar, we've got a caller. We'll take this call. Hello.
Hello, good evening.
Good evening. Welcome to Health Matters.
Good evening. My name is Bolami. I wanted to ask the doctor a question, actually.
Go ahead, please.
Okay, but my question is, actually, I have a relative, who's very close to me, who, she has sickle cell, and she was unable to take her young disabled child to many appointments as a result of, constantly being in hospital and everything. Social services, who you say are there to help, they ended up taking the child from her, and this led her to become very depressed, and and so, she was given medication and everything for the depression, and she started to gain weight, and she became very dull, not really, not communicating much, isolating herself much more, and I think as a result of the medication. So obviously family and friends were advising her maybe not to take the medication. In this sort of situation, what would be the doctor's advice? Obviously, I am sure he's going to say something like that she should continue the medication, but the medication made her become a totally different person, somebody that we don't recognize, somebody we don't know anymore. So it's a bit difficult in terms of background, where you're coming from, culture, what you're told to do and not to do by family and friends, and what the medical field are suggesting is the best treatment.
Okay, thank you very much for the question. This is a very important question. I do understand, because of side effects, people might not want to take medication. But one thing I need to let you know is that there is no medication without side effects. Even paracetamol can give people side effects. Sometimes it's really about, looking at weighing the risk and benefits of taking the tablets. If you feel that, if you don't take the tablets, you're going to be depressed. And, if you're depressed, you're not going to be able to do anything. You may end up in a situation where people feel quite suicidal and wanting to take their own life, which is a very serious thing. But yes, people can gain weight on medication. The first thing I would like to say about that is that, we have to choose the best medication for each individual. There is no one size fits all. We go through the possible side effects with each of the medication. Some are better with regards to people gaining weight or not. It's about, discussing this with the patient. And when it does actually happen, and which happens, it's not only medication that we use in depression that causes weight gain. A lot of other medication used in other conditions can cause weight gain. Then the issue now becomes, how do we manage the weight gain? So it may involve having to refer to dietitian to look at their diet, may involve having to support with physical activities and increasing their level of activity, like going to the gym, and eating healthy diet, But so that's why I said at the end of the day, it's about looking at the risk and the benefit of this medication. If that medication is going to make you to have a decent life, for example, able to go to work, able to have a family life, social life, and those things, I think that would be a good thing, And like I said, because medication do have side effects, but occasionally, in fact, in some cases, we do give additional medication to counteract the side effects of one medication. So, I mean, that would be my take on that.
Right, that's a great answer, actually, sir. Thank you very much.
Thank you for calling.
So much. Thank you so much. That was actually a good question. So we are actually rounding up for today. I want to say a big thank you to all my callers, to our audience, to my guests, and all my admin and my producer. Thank you so much. And the person of Mr. Adebowale Bankole, and also to my admin and the person of Mrs. Olufumilayo Ogatimirin. And a big thank you to my guest. He's left everything. He came in here to give back to the community. Seeing a private psychiatric, like I said, is not talking. People will pay to see psychiatric, know how much comes out of their pockets. But he did it willingly, just so that people out there can know the mental health. We do this thing, we save people every day. We understand the pain people are going through, keeping quiet because they don't want stigmatization. So that is why we set out this program to say, no, we can't continue living in silence. We can't allow people to dictate our life for us. We can't allow people to make us short. When you have a problem, and when you have the right medication, you get healed on time. But when you keep quiet, you die gradually. And by the time it's unbearable, and by the time those same people will know, all they will do for you is just sympathize. You will be the one to suffer the pain. You will be the one to suffer whatever the consequences of not taking the treatment. So a big thank you to everyone. Before I close the program today, I want to say a big shout out to my brother. It's his birthday today, in the person of Alhaji Lukman Olushola Silu. Happy birthday to you. Long life and prosperity. Thank you to everyone who has joined on the program today. I will see you next month on another edition of Health Matters, whereby we'll be talking about a different issue and we'll be looking at how to get support. Before then, stay blessed. Enjoy the rest of the week. Thank you. Bye.
Prevention is better than cure. Don't do it. Put your bed. It's only there. Then ocean,